Serious, Dr. Overit, what was the saddest death you have experienced in the hospital? 3-year-old child had been left in care of mom's best friend. He was beaten, burnt, and sodomized. He was found in critical condition when friend and her boyfriend called 911 after he fell down the stairs. Irreversible brain damage. Couldn't imagine the pain he went through. He died a few weeks later. Luckily, friend and boyfriend eventually went to trial and were locked up. Tore me up for quite a while. We had a middle-aged woman come to the ER for a bad headache. She was otherwise healthy. A brain scan showed she had stage 4 brain cancer and an estimated 10-14 days to live. Her judgment and understanding was affected by the tumor, so she didn't understand what was happening. The hardest part was telling her husband that his wife, who was fine the day before, is never leaving the hospital and there's nothing he can do. Wow, this is so heartbreaking. A 33-year guy with an IV drug habit relatively hidden from his family. He was sent to the ICU for endocarditis and was starting to improve from septic shock when his wife decided to bring in the kids to visit daddy. Sadly, on the day of their visit, he had a cardiac arrest and we had to usher the family out while we performed CPR. Hearing the crying of a grade school kids in the background of a code is something that will always stick with me. God, I am so sorry. There is nothing I can say to take away those cries. But I can say, you are amazing and the heartbreaking work you do. Please know that it means the world and beyond to the rest of us. Doctor, a few years ago I had a 50-year-old guy on our intensive care unit who had a cardiac arrest overnight from a pulmonary embolism, but had survived so far. He had a colon cancer removed 1 week before and had been doing really well afterwards, walking around the ward, almost ready to go home. Generally healthy guy apart from this. Now after the arrest he was clinging on to life by a thread. I came to review him as part of my normal ward round and his daughter was there with him. Very upset as anyone would be. I chatted to her and examined him, explaining what we were doing for him. She knew things were not looking good. As I was writing my notes in the corner she started just wailing, "Dad, come on dad, don't leave us now. Please, don't do this. I can't manage without you." I almost lost it completely. It was so sad. I spent a very long time washing my hands in the corner. Shortly afterwards I and my boss went to talk to his family about his prognosis. He was almost certainly going to die. It was his wife, daughters, and 75-year-old mother. I could hardly look his mum in the face as we were talking to them. Old people crying has to be one of the hardest things to see. Normally they are tough as nails. Then the cardiac arrest alarm went off. I looked at them all and ran out of the room. It was him. We couldn't save him. Jesus, I can't even imagine that pain. It scares me so much. I'm so sorry and so in awe that you put yourself through that to help others. I'm in a subject area that could be used to get into treating patients. It scares me how much I would become invested in them. I don't want to be heartless, but I don't know if I could handle their trauma. Anesthesia resident in St. Louis, on my pediatric rotation. Went down to the ED for a gunshot wound, arrived to the trauma bay and found a crowd of providers doing chest compressions on a girl who couldn't have been older than 4. She had a very active bleed coming from a bullet wound in her sternum. Intubated, IV access, gave fluids, EP, and after 20 minutes of coding they called it. The collective weight on everyone in the room was palpable. Nobody knew her more than 20 minutes, but goddang is it sad when an innocent child dies. I used to do psych consults in a huge metropolitan area for different hospitals that were in the same network. All very different demographics and different work cultures. When the extremely rare child death occurred, the entire staff would be shaken for weeks. Like the grief and guilt was palpable. I can't imagine working in a children's hospital. I've seen too many to count at this point in my career. Here's one that sticks with me. A mother with a baby at full term was in a bad motor vehicle collision. We did everything in our toolbox to try to save the mother and the baby. CPR, massive blood transfusion, C-section, and more. Neither made it out of the operating room. A nurse here, not a doctor. Anyways, a 24-year-old running a local half marathon or 10k. He told his friend he didn't feel great, collapsed at the finish line, coded and died on arrival to the ER. The physician, A stone cold guy called the kids' parents to tell them they lived in another state, and he had tears in his eyes. Both the kids' parents were doctors. They asked if we shocked him, gave him EP. We said we did everything. They declined an autopsy. We assumed he must have had an unknown cardiac myopathy and it finally caught up to him. I still remember his face and his story. Breaks my heart. Emergency physician. Most deaths I see aren't immediately sad because the ones that come to me have already died or on the brink of death. There is no time to build any context or relationship with the patient or family, and therefore not easy to experience strong feelings. But one stuck out to me greatly, not because of the actual death but because of what happened afterwards. A 35-year-old unfortunate woman was suffering from metastatic breast cancer to the brain. The tumor was slowly swelling and causing her to start to become altered. She could tell she wasn't thinking or communicating clearly, and it frustrated her and her husband to tears. The other thing was that her cancer was already known to be terminal and her days were numbered. I sat and talked with them about her CT results. Offered to have her watched in the hospital, but we all knew she'd probably be best spending her last days at home with her family. Normally I don't let altered patients go home, but in this case I thought it'd be best. I sort of forgot about her until her husband presented to me as a patient a year later. He told me that I did a great job and that they were grateful for my care, but she died a few weeks after I saw her. She left behind 2 kids. He gave me a hug that day, and we cried together. First and only time I've ever cried on shift. There are a few that stick with me. I'm gonna try to use layman terms as much as possible, but if anyone wants me to elaborate I can. A 32-year-old woman developed a necrotic bowel, dead guts. We coded her for an hour, because we would continue to regain a heartbeat for a few minutes at a time and the family took that as a good sign. Finally, we get a strong heartbeat, but I felt like the damage had been done. Over the next few days she deteriorated, until one morning I come in and find her pupils are blown. She was absolutely brain dead. She wound up getting pulled from life support that day, on her son's 12th day. A 47-year-old lady with metastatic breast cancer, but no family, and she lived in absolute poverty. Healthcare costs bankrupted her, pretty much. All she had was a house, but no electricity, water or gas to heat the place. She came in one night saying she was really cold and hadn't eaten in a few days. We admitted her, and she died the next day. No family, no friends. The only thing she had with her was a written will leaving everything she owned, her house, to a local church. A gentleman who was a Vietnam War vet came in because he could no longer swallow. He had horrible bone cancer of the jaw, so his left lower jaw had grown to the point where he could no longer close his mouth and his teeth pushed out and into his lips. He had no insurance other than the VA insurance for veterans, and since he wanted to be comfort care they wanted to play games about getting him any kind of long-term IV nutrition. While he was stuck in insurance limbo, we could really only give him pain meds and watch him wither away. He also died alone, and had a small service at the local DAV where some other vets showed up to pay their respects to a fallen brother. I am so angry about the Vietnam vet that I am literally turning my computer off for the night. The way this country freaks over those veterans they politicize is the most infuriating, disgusting, disgraceful thing the government does, and there are many to choose from. RN. Received a patient maybe a day or 2 after she came in. Absolute sweetheart on BUP, large amounts of air, who cried when I braided her hair that day because nobody took the time to in the days she has been here. Came back maybe 3 days later, and she was on hospice care. Turns out her oxygen levels dropped super low that night and they were only doing comfort measures. I walked in, and she wasn't that conscious. Her breathing was labored, but I had a comb and our shampoo caps in my hand as I slowly combed out the previous braid I made and made one that hid the BUP mask. The family this time was in tears as I talked to her and joked about some stuff we joked about a few days prior. She ended up passing away maybe an hour after that, but I still feel so honored to be with her during those last precious hours of her life. One of my longer frequent flyer patients died a few days ago. I'm happy they finally agreed to hospice care, but at the same time I'm definitely going to miss him. This is the one that really got me because I braided my mom's hair after her mastectomy. She's cancer free now, but there's something about the vulnerability of someone who's cared for you your entire life being unable to even lift her arms to comb her hair is just really hard. Nurses like you truly are angels and scrubs. Nurse here. I had a patient who knew they had very little time to live and was working on a letter to their estranged child. When I went in the room to help with after-death care, I found the letter where they had only written half the first sentence before they passed. They died alone. This is my worst fear, dying slow enough to know that the end is soon, but quick enough that I don't get everything written that must be written and said that should be said. Nurse in the medical IQ here. I once took care of a 30-year-old breast cancer survivor. The woman had had a son 6 months prior and the cancer came back aggressively. Tests and imaging confirmed the cancer had spread to her lungs, liver, kidneys, and spine. She was treated from the neck down for acute liver failure, sepsis, respiratory failure, and acute kidney disease. She was jaundiced from head to toe, trached and vented, required a suprapubic catheter that drained bloody urine, daily dressing changes for her stage 4 tunneling pressure ulcers, her skin weeped serous fluid, required continuous dialysis, IV narcotics to mitigate pain, and had around-the-clock heavy antibiotics and antifungals to treat her ongoing infections. Nearing the end of her life, she required 3 different pressor medications and continuous PRBCs and platelet infusions to maintain her blood levels and blood pressure. After all of these invasive and harsh medical interventions, she was not getting any better. However, she was still mentally stable, was able to answer yes/no questions, and her husband would hold up his phone so she could FaceTime her son nightly. Due to her unrelenting disease, the medical team encouraged the husband to make her comfort care and to withdraw interventions to let her pass comfortably. The husband refused to retract her full code status and still hoped she would get better. The night I had her, she required 7 units of blood, 3 platelet infusions, and she was bleeding from every orifice from progressive dick. We had 2 crash carts outside her room ready and a slew of somber nurses ready to code her. Her case was so bleak the doctors enacted a 2-physician code status change to make her comfort care against the husband's wishes to withdraw care. I left at 7:30 that morning and she died at 10 AM. I can understand the husband thinking that she could get better. If she fought cancer into remission once, she can do it again. You don't want the doctors to give up, but sometimes the patient is so sick with no chance of recovery. Instead of treatment, you are just prolonging their suffering. I wouldn't be able to pick one. The hardest confirmations are ones with big families. In the palliative ward, a grandmother passed away surrounded by her husband, sister, about 6 adult children and their spouses, and many grandchildren. She was about 65 pounds when she passed and had terminal apnea. It's sometimes called a death rattle, where a dying patient is gasping for air. They had to pull her daughter out of the room because she was so distraught. There was nowhere else to fit the entire family, so we ended up in the courtyard. It was raining that day, but none of them cared. The children didn't understand and kept playing, so I ended up taking them to the other end to show them the flowers while the palliative care team talked to the family. The most memorable one was a child with a recurring hematological cancer. She had a great sense of humor and wanted to grow up to be an artist. Charities visit the children's ward and they all knew to give her paintbrushes, sketch pads, etc. because she didn't want toys. The nurses put her many drawings up at the nurses' station. Her parents were really struggling with all the appointments, financial burden, etc. So to my surprise, the mother fell pregnant. They were hoping for an umbilical stem cell transplantation. Cord blood is a significant source of stem cells, which could be used for their daughter's treatment. Their daughter suddenly died of an infection weeks before the mom was due to give birth. That death rattle, I've heard it from my grandfather, died from drinking, my grandmother, dementia and strokes, and lastly, from my own father a few years ago, visited him every day while he was heavily drugged at home, from drinking. Frick, I'm glad I'm more proactive about my drinking. It's still an issue, but I'm working on it not fricking my life up. I don't know if it counts. Those were the incidents which led to a patient's death from pneumonia in intensive care a month later. Poor fellow, 70M, was informed that it would be best to move to a retirement home because of his disabilities, was at the clinic after multiple surgeries for herniated discs, and that he'd probably not be able to care for himself in his apartment. We later found that at first he'd tried to cut his wrists with a razor, not a blade, the cage ones, while he wrote his suicide note, which of course did not work because these things won't cut deep enough, leaving his room in a bloody mess. I was called several hours later at midnight. because he had been found silently moaning in pain beneath a third-floor window with severe hypothermia. The patients and nurses who found him initially thought that he had been drinking and that he'd stumbled on the way back inside and then fallen into the garden bed, but after bringing him inside and a look at the severe injuries of his legs, won't go into detail, the worst injuries I have seen in my career, it became clear that he had jumped out of that window legs first. His intention worked out with a gruesome delay. Such a sad and unnecessary death, just because he felt that it would mean the complete loss of his autonomy to move into a retirement home. Interesting how this got the starting point for a discussion on assisted suicide. This patient could have probably been saved if the information would have been presented to him with a more careful wording and by leaving him more than one option on how to carry on with his life. A nursing service would have been possible as well, in my opinion. It was not my patient. Worst one was a 17-year-old patient with cystic fibrosis. Got a lung infection, which are common in these patients. It progressed to a bloodstream infection and bacteria was resistant to antibiotics. Was a wonderful family, close, loving parents and siblings. Was a relatively rapid decompensation, ending up on multiple infusions of continuous medications to maintain his blood pressure. Finally starting having profuse bleeding, process known as DIC related to the bloodstream infection. He then went into decompensated shock and shortly thereafter arrested, bleeding from nose and mouth profusely. Parents had been prepped, but being in there doing CPR when dad realized it was over. There was something about it that was just really bad. He told us to stop, then hugged his kid and kept saying, "I'm so sorry, I love you." His mother let out a scream that I can still hear. This was about 12 years ago when I was a resident. I'll never forget that scream. I'm an academics and a subspecialist. I sadly see kids die often. This was the worst that I witnessed. Any child dying is horrible, but I find that the older ones you connect with and that have a strong bond with the family are really hard. One of my bosses would tell us that if it ever got easy then you need to effing quit. I was charge nurse, RN, at a nursing home. Most needed long-term care, but we had a handful of hospice patients there to die with dignity. One of our long-term patients had to be rushed to the hospital. After a few days she came back to us on hospice care. It was my responsibility to go over all options of the advance directive and outline what the patient wanted to happen. We wrote it all down, but it didn't become law until their primary caregiver, doctor, signed off. I sat with this woman for more than 2 hours discussing options. Finally, she decided against all extraordinary efforts. No CPR. Basically no resuscitations. She was ready to pass and decided to do so as peacefully and with the most dignity that she could. Her husband was there with her for the decision process. I filled out the paperwork for her doctor to sign the next morning. Not more than 2 hours after this conversation the patient codes. Although I knew her desire for no extreme measures, because her doctor had yet to sign off, I was forced to do everything I could. In front of her husband, who trusted me to follow his wife's wishes, I had to perform CPR. I broke this old, frail, 90-pound woman's ribs as I attempted to bring her back to life with no avail. I went against her and her family's wishes because the law required me to have a doctor's signature. I didn't bring her back, and felt ashamed even though I followed the law. Dang, I am sorry. I'm a nurse, and I've seen so many sad deaths that it's hard to pick just one, but one that stands out. We had a patient who had cancer and had to be tracked. She spent over a month in our ICU on the ventilator. Her very sweet husband stayed in her room basically 24/7. He slept in the recliner and lived on Dr. Pepper and Doritos. We got to know him very well. After about 3 weeks, the nurses finally convinced him to go home and get a real night's sleep in a real bed. The next morning, he didn't come back. His son called later in the day to tell us that he had been found dead at their house. We were all completely shocked and very sad. He was one of the nicest, most helpful family members of any patient I've ever cared for. Losing her husband was obviously hard on his wife, and her health declined steadily and quickly after that. She just gave up. She was dead within a couple of weeks. I was a pharmacy student going on rounds early one morning. We had just rounded on a mid-30s female with ascites that was in ICU. We were at the other end of the hall when a code was called. It was for the ascites patient. She apparently had a huge pulmonary embolism that resulted in her death. They worked on her for 20 minutes but to no avail. The hardest part was to see her son come and visit her, only to have the nurses tell him she passed 5 minutes ago. I can still remember the son, kneeling by her bed, crying hysterically. Ugh, that just breaks my heart. Medical student here. The saddest one for me was in the air. A young woman came in with a very bad asthma attack. I wasn't involved in her care, but we all heard her pleading, "Please don't let me die," between gasps of breath. This is just horrific. I can't even imagine the guilt and pain of losing a young patient like that. ED provider. 4-year-old riding on lawnmower with grandpa. Fell off GPA's lap, was run over by lawnmower. Flown to our ED trauma code. Lots of heroic measures. Kid makes it. Fast forward 6 months, kid's grandma was bringing him to the hospital for a skin graft. Cosmetic work to fix wounds. And they get in a car, crashing, killing them both. Holy, that's really rough. I hope the family is okay, and I hope you're doing okay, too. Graduated medical school a month ago and starting residency next week. The saddest experiences I've had in medical school didn't happen in hospitals, since most patients I would see there would be very old and their deaths were expected since they had many comorbidities. If there were younger patients with a terminal disease, such as late-stage cancer, they would often be sent home on hospice after exhausting treatment options. The saddest parts for me were in primary care doctors' offices whenever patients were told bad news, such as a terminal diagnosis, poor prognosis, or discussing end-of-life decisions. These doctors often had the same patients for many years, so it would often be a much more personal moment than the same scenario playing out in a hospital. Some people's lives end way before they actually pass away. Working in that kind of environment takes a certain kind of willpower, and it's impressive that you're capable of it. As a hospice nurse, the one that stuck with me was a 17-year-old girl. She had some bowel issue no one could diagnose. Her digestive system just failed. She had so many scars from all of the surgeries she had endured. She was so charming and beautiful and funny. She was a painter, and I am a painter as well. So I brought her my desktop easel to paint her final piece for her aunt. She was deeply into the macabre. So I bring an artist, and knowing the creative type, I set up to have some friends come see her in their entire costumes. My friend was a makeup artist for The Walking Dead. The group came in these elaborate costumes, giant headgear, the whole 9 yards. She was thrilled to see them. I loved her. She even dressed up one time to show me her gown she wanted to be buried in. She was beautiful. She died on my day off. Everyone in the unit was so generous with me because they knew I had gotten attached to her. I had to leave hospice after that. My heart couldn't take it. I work in the OR now for a large hospital in my area. That was almost 2 years ago. She still crosses my mind, and my heart aches that such a beautiful, charming young woman lost her life before it had even really begun. DNP here. I work in a palliative consult service. Not all of my patients are terminal or necessarily close to death. Suffice to say, I have encountered a wide variety of death in my career. Particularly difficult were kids or parents when I worked as an organ transplant coordinator. Oddly, this is none of those. The case that I'm going to present bothers me because of its unnecessary bureaucratic cruelty. I received a consult for a 58-year-old prisoner with a life sentence for murder. He was diagnosed with a leukemia and offered treatment. He was otherwise healthy and stood a decent chance of some response to treatment. He refused all treatment. To paraphrase, for what? I fought and killed a man when I was 18 and dumb enough that I believed I needed to look tough. All chemotherapy will get me is more time back in the box. I have nothing to offer, so why take this treatment? Give it to somebody else. I was not there to judge him for his past crimes. I saw him as honest, stoic, polite, and human in that moment. Over the course of the week he declined everything other than food and labs. He deteriorated impressively fast. In the past 30+ years, the only family member who stayed in touch was his cousin. She was 45 feet away in the ICU waiting room. He was shackled to a bed bracketed by 2 large prison guards. His dying request was to see his cousin face to face. The warden refused any visitors other than first-degree relations. I tried to communicate a request to the warden but was declined. Not a first-degree relative, just the one that mattered. He died shackled to a bed with the only relation in the world who cared on the other side of the locked ICU door. He knew she came, but they never laid eyes on each other. That hurt us all. Just freaking cold. It sounded like it really was. Dang. Grandmother, older sister, 11yo, and the patient, a 7-year-old girl, was brutally attacked by an uncle, high on drugs, looking for money. Grandma wouldn't give him any. Uncle decided to hack them to pieces. The girl's mother and father died in a car accident a few years back. The grandfather worked as a sailor. He was nearing retirement and had modest savings for both girls' college education and then some, and sent money home to his wife and grandchildren. Grandmother and older sister didn't survive. The patient, the 7-year girl, was in the ICU. A kind neighbor took care of their affairs because granddad was in the middle of the ocean and had to request an airlift to get home ASAP. Patient dies while granddad was still in transit. The grandfather's only living relative left, the uncle. This is the most shocking. I hope that the grandfather is doing well and that you weren't too badly affected. This is pure evil. Mothers losing their child. It's always expected from our end. We're not a trauma hospital, so there's usually a few days, if not weeks, of warning and conversations and consults to palliative med, and careful charting and deteriorating labs. But in the 2 saddest cases I've seen, the family adamantly refused all end-of-life conversations. It was a shock to them, and still when the end came, the mother crying and screaming her child's name sent electric shocks down everyone's spine. I can still remember everything about those moments. I remember one CNA from a different room running to one of the mothers and just absolutely tackling her into a firm bear hug, because the mother didn't know what to do except cry and try to hurt herself and other people. None of the rest of us knew what to do. She was so distraught. She collapsed into the CNA, who really wasn't paid enough for her instincts. I can still remember the mother screaming her daughter's name. My neighbor's 12-year-old daughter died. Another neighbor's daughter was in the same for a broken arm at the same time as the girl was brought in, and that mom told me later she will hear our neighbor's screams from when the family was told the girl was gone in her head until her dying day. Lady was at a golf event with her family and decided to drive the cart. Wasn't doing anything crazy but drove the cart off the path and it went tumbling down a steep hill. She broke her neck and became a quad. While in the hospital and on the ventilator she went for a tracheotomy, but it got messed up and long story short she died. Had a family and kids. I don't know why but that one always stuck with me. Just a random day at the golf course and next thing you know your life changes. My middle school vice principal died when her tractor rolled. They have a blueberry farm and she was out one day tending it and hit a big enough rock while on a hill that caused the tractor to roll. I heard she was dead instantly, but I'll never really know. Her kids were like 2 and 4 or something at the time. Neurosurgery resident here. 2 cases that stuck out in my mind. First was an elderly gentleman. He came in after his son found him down on the ground. This is because old man was supposed to pick up son at airport. Son lived in Europe and hadn't been able to visit in many months. Father never showed at airport. Son waited for 2 hours before calling a cab. Arrived at father's house to find him down in the kitchen. Taken to tertiary trauma center where he was found to have a very large intracranial hemorrhage with essentially 99% 30-day mortality. Son elected to let him pass. Always stuck with me because son hadn't seen him in months years and he died the day the son arrived. Second was not a death but a horrible accident. 29-year-old in the prime of his life makes one mistake and dives into water a little too shallow. Teardrop fracture of C5 with complete laceration of the spinal cord. This is a strapping, intelligent, engaging, charismatic young man who will never walk again, never hug his loved ones, never feed himself, etc. All because of one split-second mistake. Frailty of life, bro. Oh, there was also the guy who was murdered at his younger brother's funeral. Younger brother was murdered 5 days prior. Delivering the news to that mother sucked. Pharmacist here, which is a doctorate degree, so I'm counting it. Just this last year I watched an 8-year-old little boy die in the emergency room after an hour of CPR. Nothing you train for in a CPR class really ever prepares you for the ordeal of actual CPR, especially on a child. The chest compressions rock their whole body every time. This boy had been experiencing flu symptoms for a few days. His dad had been helping him to the bathroom when he just collapsed and went unresponsive. His dad immediately started CPR at home. Paramedics got there and got him to the hospital within 15 minutes. He had been complaining that his chest hurt the day before, but his parents didn't bring him in for whatever reason. It was later determined that he had a heart attack, most likely due to the flu. The boy's mother was in the room while we were trying to save her little boy. When the doctor called time of death, she let out a wail that I thought would make her eyes bleed. The sounds she was making are embedded in my mind forever. I can hear them even now if I stop and think about it. There was not a dry eye in the room, especially me, as this boy looked like an older version of my own son who was just a couple years younger. I read his obituary later. He was your typical golden child. All his teachers and classmates loved him, etc. I went home and hugged my kids extra tight that day. The only thing that even comes close to a mother's love is a mother's grief. I understand that sound. I was at work one day when a colleague was informed her only child had been killed in a car wreck. The howl she let out, I will never forget it. It was guttural and primal and like nothing I have heard before or since. Absolutely harrowing. You have been visited by the holy doggo. Like and subscribe, you magnificent person.